Infertility, a very interesting topic. One would ask, what is infertility? Infertility, as the name is a medical condition where a person is unable to conceive after 12 months or more regular unprotected sex for 1 year. One would ask, who is affected? It affects 8 to 12% of couples worldwide. There are two major types of infertility. One is primary infertility. In primary infertility, one is unable to conceive. The person has not conceived at all. Two, secondary infertility. In this case, there has been a history of a previous conception. Now, emotionally, financially, and psychologically, it makes a great impact on couples. What are the causes of infertility? Now, let's start with women. Causes of infertility in women. One, we have ovulation disorders, polycystic ovarian syndrome. What is PCOS? This is a common hormonal disorder that affects people with ovaries, usually during their reproductive years. This could be between the age of 15 to 44. In polycystic ovarian syndrome, the ovaries may produce higher than normal amount of male hormones, which are called androgens, which can cause irregular period or missed period, difficulty in getting pregnant, excess hair growth, especially on the face, on the scalp, and at the back, acne, weight gain, or difficulty in losing weight, thinning hair, fallopian tube blockage or damage. Here, you can have pelvic inflammatory diseases, previous surgeries. Endometriosis is another cause of infertility. Here, there is tissue similar to the uterine lining, which grows outside the uterus. You can also have uterine abnormalities like fibroids, polyps, congenital causes, age-related decline in egg quantity and quality. Some book says from 30 years. Causes of infertility in men. Low sperm production can cause infertility in men due to genetic defects and undescended testes. Poor sperm function. Here you can talk about abnormal shape or motility. Blockage. Yes, obstruction preventing sperm delivery can cause infertility. Health conditions like diabetes, infection, environmental exposures like pesticide, radiation, overheating testes, lifestyles like smoking, alcohol, and use of drugs. Also, stress. Risk factors for infertility. One, advancing age, tobacco and alcohol use, being overweight or underweight, excessive physical or emotional stress, STIs such as chlamydia, gonorrhea. Please kindly get yourself treated. Environmental toxins and occupational hazards like heavy metals, industrial chemicals, air pollution, radiation, family history of reproductive disorder. All these are risk factors for infertility. Now, diagnosis of infertility. First, a detailed medical history needs to be taken together with physical examination, blood test, hormone level, semen analysis like sperm count, shape, and motility are important. Pelvic ultrasound for females, fetal sapingogram, HSG, to check the fallopian tubes. What are the treatment options for infertility? Yes, there are treatment options. Medications are one of the options used to stimulate ovulation. You can use clomid or letrozole. Surgeries can also be used to correct any anatomical issues. Intrauterine stimulation, IUI. Here, there is placing of sperm directly to the uterus. IVF is another solution. In vitro fertilization, fertilization outside the body. You can also do ICSI, otherwise called intracytoplasmic sperm injection. Like the word said, sperm injection, injection of sperm into an egg. You can also do egg or sperm donation, even gestational surrogacy, lifestyle, and dietary changes. This can help you in treatment. Now, how do you prevent infertility? 1. Maintain a healthy weight. Avoid smoking, alcohol, and drug uses. Protect against sexually transmitted diseases. Practice safe sex. Manage chronic illnesses like DM very early. Minimize exposure to environmental toxins. Regular reproductive health checkup. This can help prevent infertility. How can you cope with infertility? Yes, you can cope. You heard me right. You that is watching this, you can cope through emotional support, therapy, and counseling. There are support groups now where you can share your experience with others. Open communication with your partner, most important. Exploring alternative family building options like adoption, self-care practice, mindfulness, stress reduction. In conclusion, infertility is a common yet complex medical condition. Early diagnosis and treatment improve success rates. Emotional well-being is vital during fertility journey. Multiple paths to parenthood exist today. Don't you give up. I still remain my humble self as Dr. Kabi. If you have any question, comment in the comment section. Don't forget to like and subscribe. See you next